We know that education is certainly impactful for many individuals, but at the end of the day, education alone isn't going to make the major changes that we need to see in order to improve health in Kansas. So K-State Research and Extension is dedicated to partnering with state agencies, organizations, nonprofits, everyone, to talk about health, to talk about what we need to do to work together to improve health in Kansas.
K-State Research and Extension uses a variety of research and evidence-based information to assist extension agents and specialists tackle issues and concerns at the local level. The recently released Behavioral Risk Factor Surveillance System, which is coordinated and partially funded by the Centers for Disease Control and Prevention, is one resource that Extension uses to compare health data and health-related trends over time. On today's Sound Living, facilitating community conversations through Extension's Culture of Health initiative. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman. The Behavioral Risk Factor Surveillance System, or BRFSS, has been conducted annually in Kansas since 1992. It's the only source of population-based data for several public health indicators in Kansas. It's used to plan public health programs, identify at-risk populations, and emerging health problems, as well as to track health objectives and monitor changes in health risk behaviors and diseases. Extension Nutrition Specialist Sandy Procter and Extension Adult Development and Aging Specialist Erin Yelland say data from the BRFSS survey can help address health needs in communities across the state. However, the latest survey only collected data from 40 of Kansas's 105 counties. While it may not be a full picture, it does provide a snapshot of the health issues facing the state. And because Extension has offices and agents that serve all 105 counties, Yelland says they're able to help identify needs at the local level.
Absolutely. So K-State Research and Extension has been actively involved in initiating conversations at the local level about what are our current health needs, as well as what are our current health resources in our communities. And while we can certainly supplement the data that we have at the state and federal level, oftentimes we're finding that when we get out into local communities and have those critical conversations, we're really getting to the root cause of what people's needs are and also ideas for how we can improve health across the state of Kansas.
This was broken down into several different age categories. I think it was like 18 to 44, 45 to 64, and then 65 plus. That also gives us a lot more data, especially in some of those specific areas.
Yeah, so this really gives us a good snapshot of what the health needs and resources are across the entire lifespan. One thing that we have to remember, though, is that this isn't necessarily including our kiddos across the state. So that's one area where this survey is really lacking. But it is good that we're looking at these different groups of people because they do have a lot of things in common across the lifespan. So it's really interesting to look at the data that way and say, what are the needs of, younger adults? What are the needs of our middle-aged adults, and what are the needs of our older adults, and be able to take that information and apply it within our communities.
They have a number of categories and a number of things that they look at, and I want to maybe focus in on just a few of these different areas. One of them that I was thinking about, especially in terms of what you work with, Sandy, a lot, is trying to get people to eat more fruits and vegetables, have a healthier diet, and this is something that, from what I see from the data, we're not making as much progress as we would probably like in terms of getting people to eat more than one fruit or more than one vegetable a day.
Well, and it's extremely important as we track those data that just never catch up with the recommendations that we notice that we're also tracking the incidence and the prevalence of chronic diseases, too. Those are not unrelated statistics. And so as we continue to see that the practices are not supporting the best health possible, we realize that probably in many cases it's not a matter of more education is needed. Instead, more of how we can help that access increase, help move those healthy behaviors to purchasing more fruits and vegetables or selecting them when they're available, and not just you should eat more fruit and vegetables. That's not where we're at. But we're able now to say, look, our population is not as healthy as it was even a generation ago, and a lot of it has to do with these chronic disease risk factors that we have control over, but we are not making the smartest steps.
Cost is always a factor, and I think they have taken some steps in the last few years to try and make it easier for lower income to buy fruits, vegetables, and other healthy food.
There's been a lot of emphasis in that direction, and one of the biggest ones is a result of the recently passed Farm Bill. It has a lot of money in there for incentive programs for fruit and vegetable purchase for SNAP recipients. And these are programs that are specifically designed to match the amount of money that is spent from SNAP by people with SNAP benefits, match that, and so that there is twice as much available in the way of fruits and vegetables as there would otherwise be. So really a concentrated, focused effort on lowest income populations, those who maybe for whatever reason have access issues, whether it's actual availability of fruits and vegetables or access because they can't afford it or access because they're only able to get to the store less often maybe than they need to. But to help combat that through increasing the amount of money that's made available to that specific audience for that specific purpose.
Erin, cost is also a factor when it comes to health care, and I think that showed up in this survey as well.
We often see that when individuals are unable to afford their own health care, that oftentimes impacts their overall health outcomes as well. So we will see that perhaps they're not able to manage chronic conditions as well because they're not going to the doctor to get prescribed medications that can help to manage their hypertension. Or perhaps they're not getting the information that they need to help manage their diabetes in a good and healthy way. So having overall accessibility to healthcare has huge implications that many of us don't even realize. If you don't have insurance, that is a major determinant of your health. So this data is showing us that we're still not where we need to be in this state and in this country in regards to having adequate healthcare insurance coverage for everyone.
I think it also showed there was a fairly large percentage of 18 to 44-year-olds who didn't even have a personal physician. So that also is a problem.
Yes, so even if you do have insurance, we see that many younger adults just simply think that it's okay to not go to the doctor, when actually the recommendation is, if you are a relatively healthy individual, that you go and see your primary care physician at least once a year for an annual checkup. So you have to remember that if you're not going to those appointments, you're also not getting early cancer screenings. You're missing a whole awful lot of opportunity if you don't go to your doctor regularly.
A lot of what is covered in the BRFSS screening is information about different types of health screening. So are there signs of depression or mental illness, indicators that could really be useful and extremely helpful to a person, to a community, if those are caught in time. And so it's not only just to report back what is already the case, but to show us trends that are changing over time that can tell a community, can tell a group of concerned citizens, this is a step, this is a place where we really need to take action.
Along those same lines, we also have had some stigma with mental health issues, and that is something that I think maybe we're starting to see people are not so hesitant to discuss it now, because it seems to be something, especially among the 18 to 44-year-old age group, where they are willing to admit that they struggle day to day, or that they've maybe had problems 14 out of the last 30 days, which maybe in the past is something people would not have done.
Absolutely. So we have seen large generational changes in the ability and willingness to talk about mental health issues. For years, this was something that was generally swept under the rug. It was something that we did not talk about, even within our families. And now we're seeing a huge switch into talking about the need for mental health services and understanding of mental health across all individuals within our communities, because it is such a severe issue. Of course, we have seen increasing suicide rates among many different populations within the country, whether that's farmers and ranchers, teenagers. We have seen youth so young taking their own lives because of bullying and other things going on within the schools. And that, again, all reaches back to the overall presence of mental health support and services within our community. And this survey has helped to give us some sort of understanding of where people stand on their own mental health status, but also the status of mental health services that are provided in our communities.
And in our own communities, we're having these conversations around the health issues that are identified there. And it makes me realize that our culture of health conversations that we had across the state just a few months ago, the overarching identified problem was with mental health. Every extension agent that was there with a community support person, those conversations brought to the forefront that mental health is a key concern across the state of Kansas and is certainly, whether the town is rural or urban, large or small, is a real issue for people all across the state.
As we identify these issues, then, what can you as extension specialists do to try and get either programming material to the county agents, try and do programs, set up different avenues for them to have access to this information? How are we kind of tackling some of the problems that we've identified?
So K-State Research and Extension is really taking a multifaceted approach. The first of which is that we are continuing to use research and evidence-based information to provide education to community members. And we oftentimes do that by bringing this information from the state and out to the local county agents so that they can reach their local community members with that educational information. A second step that K-State Research and Extension is currently involved in is what we call policy, systems, and environmental change. And this is looking at bigger changes that need to happen within our communities in order to make the healthy choice the easy choice, in order to improve accessibility to healthcare and mental health services, and in order to have meaningful conversations about our health needs and resources in our communities. And so what that's really doing is allowing us to continue to partner with individuals, entities, and agencies within our communities to really make a true difference. We know that education is certainly impactful for many individuals, but at the end of the day, education alone isn't going to make the major changes that we need to see in order to improve health in Kansas. So K-State Research and Extension is dedicated to partnering with state agencies, organizations, nonprofits, individuals, coalitions, everyone to talk about health, to talk about what we need to do to work together to improve health in Kansas.
You know, in Kansas, we're very fortunate. The extension model is that the communities identify the issues and then work with the state extension specialists to find those solutions. And it may not look the same in Atchison as it does in Ulysses or Oberlin down in Chanute, but we're going to have resources. And as Erin mentioned, they're going to be research-based. They're going to be current information, flexible delivery methods so that it works in a variety of places and helps engage that community problem-solving effort that needs to happen for it to be effective and sustained.
There are numerous sources of information that we draw on to get a thorough understanding of health in our state and in our local communities. The behavioral risk factor surveillance system is obviously one of them. We oftentimes are looking at the county health rankings, which come out once a year. But then we also have things going on locally, such as our community health needs assessments and community health improvement plans that are oftentimes led by hospitals that also give us a thorough understanding of health at the local level. So there's all sorts of data and resources that we can draw on, but at the end of the day, we have an immense need to bring all of those things together and sit down collectively as a county or as a community and have a conversation about what does this data mean and what should our next steps be in improving our county's health.
And is that where the culture of health then comes into play? That's all a part of this?
It really is. And I see our role as specialists as really sort of conduits of as many of these data sets and information and research that's coming down the pipe. We need to share that with agents and get it out on the listserv so that if they're in those conversations locally and they have the need for current information or trends, that it really is up to us to sort of connect them with those high-quality resources that are going to give them an accurate picture to be able to say, this is what we know, and this is the conclusion we can draw, and this is the information that we need to take and move forward from here.
That's K-State Research and Extension Nutrition Specialist Sandy Procter. Also on today's program, Adult Development and Aging Specialist Erin Yelland. You can learn more about Extension's health initiatives by contacting your local Extension office or by visiting www.ksre.ksu.edu. Sound Living is a weekly public affairs program Produced by Research and Extension at Kansas State University. I'm Jeff Wichman, and this is the K-State Radio Network.